Hey everybody, welcome back. My name is Kelly Troutman. I am a certified hand therapist. This video that you are watching currently is part 2 of the conservative TFCC videos that I am filming. This video is intended for hand therapists, occupational therapists, and physical therapists. Anybody in a rehabilitation field that's going to be working with TFCC tear patients that are not surgical, so they're conservative treatment. I remember being a new grad and working in hand therapy and getting referrals for patients that had TFCC tears and just feeling like this instant sense of dread of, oh my God, what am I going to do with this patient? They're in so much pain. They can't do anything. The wrist splint doesn't really seem to be helping, blah, blah, blah. And so finding activities for them to do and exercises and actually helping them and seeing good outcomes, I felt like was really difficult. So that's why I'm filming this video today, to maybe give you some ideas or kind of talk through what my treatment methods are at this stage. So I've been a hand therapist for almost 4 years now, and so obviously I have tons to learn still, and please share your tips and tricks with me down below. I'd love to get a conversation going and kind of work through some of these difficult diagnoses that it's not really that complicated, but for some reason treating them sometimes feels a little bit that way. So that's what we're going to talk through today. I'm going to go through kind of some different treatment activities that I like to do or things I'm looking out for when I'm working with these patients. So yeah, let's do it. As always, I think the first key to a good outcome is obviously conducting a good evaluation and initial assessment. So make sure that you take the time to hear what they have to say, listen to them, how they describe their pain. Make sure you know how the injury happened, right? If it was a traumatic injury like a fall or something like that, or if it was more of a repetitive, like kind of wear and tear type of injury. How did this injury happen, so that you can plan the treatment appropriately. So once you've done that, I think step 2 is education, of course. We always want to jump ahead and get right into like using our hands on, doing range of motion and all these different exercises. But I think step number 1 is education. These patients do not know what the TFCC is. A lot of times the doctors don't spend time explaining it to them. So go through it with them, kind of talk through their injury, talk through the expectations. Let them know that it is not about no pain, no gain, right? We want to get that out of their mind from the get-go. If they are having pain with a certain activity or movement, especially when they have a tear, it's not okay. And they need to know that there's like a pain-free range of doing things and kind of when to stop and how to know that they're overdoing it as well. So make sure that you're educating them. Talk through a day in their life, basically. What things are you having a hard time with? What can we maybe do some activity modification, or can we give you a tool or a suggestion for how to do it differently so that you don't have pain and you allow that area to rest and to heal? Because the first 6 to 8 weeks of a TFCC tear, or a lot of injuries, you want to keep that tissue rested as much as possible so that it has the chance to actually heal and recover. If you don't let it heal, it's going to A, delay the healing and make you in pain longer, but B, it might not even heal very well at all. And so you may have chronic problems that occur because of that. So educate them, tell them what to expect, and help them get through a day without having pain. And I think that's a really important factor. Obviously, phase 1 of treatment, you're trying to reduce their pain and inflammation anyway. So I tend to do a lot of modalities in this phase. In our clinic, we have a cold laser, so I use that a lot. People have, decent feedback about it. I haven't had like amazing results or anything, but I also haven't been studying it on its own. So I like to do the cold laser, and then we'll do warm up of some kind with paraffin wax or hot pack, something like that. I do a lot of like manual treatment, just trying to loosen up some of the muscles because again, they're usually in a wrist splint or some sort of ulnar gutter, and they're not moving it a whole lot, so they get to be tight. Doing some different like gentle joint corrections or things. I do a lot of kinesio taping as well in that phase, just to help bring their pain down and help them feel a little bit more stable and secure. Ice massage is really good for that, right? Bringing the pain and inflammation down. Once they start to be a little bit less painful, I like to move into kind of range of motion exercises. So I'll do things that kind of require a little bit of proprioception too. So I like to use like a weighted ball and have them kind of rest their hand on top of it and kind of roll it forward and backward on the table, side to side. That way they're having to kind of guide something through the space. We do a lot of, kind of, I like to do goal-oriented range of motion. So rather than just having them do the movement, I'll have them like kind of hold something in their hand and do different movements with it, or do some sort of like activity. It kind of distracts them a little bit more, and it sometimes helps them get out of their own heads a little bit. And then I usually will start to do some different like isometric exercises as their pain starts to come down as well. So doing like some wrist isometrics gently. I like to strengthen ECU for that as well. So it's a little bit awkward, but it's kind of in like a diagonal direction. So rather than having them try and go straight up, you're having them kind of push. I don't even know how to show this, like that direction, so that the ECU is firing a little bit. That tends to be a sort of an under-functioning muscle. So if we can kind of strengthen that guy a little bit, it does usually seem to help. You can also kind of look at their elbow too, because sometimes when they've had like a fall or some sort of TFCC injury or wrist injury, sometimes their elbow is kind of like out of whack or off sorts. So you can sometimes look at shifting or like approximating their elbow a little bit better, or shifting the olecranon on one way or the other. Just like some different things to look at. I still like to use kinesio tape for support. I still like to do some modalities. Sometimes I'll have them start some proximal strengthening during that phase too. So doing like rows or external and internal rotation exercises, a lot of posture stretching, those kinds of things. And then as we gradually move into phase 3, or the strengthening phase, we're doing more resistive activities. I don't usually start with gripping so much, but still focusing on a lot of proprioception and stability. I like to do, if you have like flex bar, if you guys know what that is, I like to have them hold it in their hand and kind of like, we call it like oscillations or perturbations, but it's basically like shaking it forward and back. So the flex bar will kind of like rock forward and back, and then they'll do like kind of side to side, so it kind of rocks side to side. If I'll get one and demonstrate it for you in another video. It's hard to visualize without it. Those are really good exercise. I like to have them do like kind of like wrist alphabet exercises. As they get less painful, you can have them do that with a weight, where they're kind of writing the alphabet. You can use like a big ball kind of thing, and then like either a PVC pipe, or we have like one of those little wrist roller things. It's just like a long pole. You can kind of have them hold that, and then it's resting, the pole is like resting on top of the ball, and they can kind of work the like the alphabet, or you can have them spell different words or something with it, just to work like a lot of stability. I do like to strengthen them proximally as well, because I just tend to think that helps us have better posture overall and have less tendency to be injured down the chain. But yeah, that's pretty much kind of how I have been treating TFCC tears. I do like to use the wrist widget as well, especially as they're going back into heavier activity. I've had some really good feedback with that particular brace, and I think it's just an amazing brace. I wish I had thought of it because it's so simple and patients like it. But that seems to work pretty well as well. And then, you can always continue to use kinesio tape if that works well for them too. But yeah, that was really long-winded, and hopefully that was helpful in some way. Again, I'd love to hear what you guys are doing for TFCC tears, or if you have any different ideas or questions or anything, or if you think I'm doing something wrong, like please feel free to share that with me too. I want to obviously do the best by my patients, and I want to have communication with other therapists and be able to like actually network and talk with everybody about what the best treatment methods are, and so we can provide better care for our patients. So anyway, Thanks for listening to me ramble on. You guys are the best. I hope that video was helpful. Give it a thumbs up if you enjoyed it. Subscribe to the channel if you want more hand therapy videos, and let me know what you'd like to see next. Thanks.